Hi, hello, how are you? I am Dr. Marjan, a family physician. Today I would like to talk regarding post-COVID long hauler syndrome, a part of it. We have seen now patients are complaining of neurological symptoms following COVID infection. They say lightheadedness, insomnia, and some brain fog or brain lag. I have seen in the Facebook one of our colleague, a doctor, sharing his experience in the Facebook that he experiencing insomnia. So these neurological symptoms mainly after post-COVID because its viral debris remain in our brain fluids. So today I would like to address how this brain fluid works, the physiological part of it, and how we can improve that how we can improve that fluid or glymphatic system drainage. Then I would like to address some physical activity which will improve the glymphatic system. First we will see the glymphatic system. The glymphatic system is a fluid around our brain or brain cells, neurons, which will form through the interstitial fluids and a part of CSF fluids. So CSF fluid is secreted by choroid plexus in the ventricles, and from that there are arterioles, and around the arterioles there are periarteriolar spaces which is surrounded by the astrocytes. So from that astrocytes it will pool in the neurons and come to perivenular or perivenous spaces, and thereby the drainage occurs mainly through two channels. One channel is called a meningeal lymphatic vessels. The second system is olfactory or nasal lymphatic routes. So olfactory bulb and olfactory routes is one of the main route which will drain our glymphatic or brain lymphatic system, lymphatic or lymph. So we know that the prominent sign of COVID is anosmia, loss of smell. So it's due to the at cribriform plate level the soft tissue swelling, and it will swell and inflammation of the olfactory bulb and the olfactory nerve. So if the olfactory bulb and olfactory nerve that part is swelled, and the main drainage through the olfactory cribriform area to cervical and thereby thoracic duct, it will be hindered. So we have to improve that path. So we can do we can advise our patient to get regular sleep, hygienic sleep. 6 to 8 hour at a stretch sleep is very important to improve the glymphatic system. And the brain is a circadian organ, meaning thrive on rhythm. So we have to make our sleep pattern in a rhythmic way, or meaning you have to go to sleep at particular time or every day the same, even weekdays, weekends same, and wake up in a particular time. So make it routine. Then the brain will understand your circadian rhythm of sleeping. So that is very important. And the other thing we have seen, the patients are not taking enough water. Reason for that, sometimes they feel loss of taste and loss of smell, and they don't feel like drinking water. Sometimes, most of the time, they wear mask, and they feel lazy to get rid of mask and drink water. And we are in a hot state, and thereby sweats and the vaporize from our body. And another important water loss from our body is our breathing. So after COVID, or even if you get anxiety or brain lagging, things like that, you will breathe in and out very fast. So it's tachypnea. Tachypnea will cause water loss when compared to the normal state. So these are the reason for water loss. So you have to drink plenty of water. The water drinking pattern has to be uh, directed by your urine color. So if your urine color is darker, then you have to drink some more water. So that's how. So sleep and water and a bit of physical exercise, not an exertion, just physical exercise like walking and jogging, things like that. And so I will show some physiotherapy steps to improve your lymphatic system or glymphatic system. Then balanced diet also has to be, if possible, has to be on times, in regular basis, on time. Some people say some medications also help to improve these neurological symptoms, like fluoxamine is an SSRI. So I avoid this part here because sometime I will make this to understandable non-medical people as well. So to improve the glymphatic, we have to we have to do some physical exercise. So this physical exercise mainly, I said, drain through the one from the meningeal lymphatic vessels. The other main route is from the olfactory cribriform fluid to olfactory, from the nasal area to cervical nodes. So you have to empty the basal, the neck base lymph nodes and go up. So I will show how to do it. So you can do like this to so you can keep your collarbone or clavicle and keep like this and make like this 5 to 10 times from one side, and the other side also 5 to 10 times. Or you can do from both hands like this, and like this 5 to 10 times. So it will improve the drainage from the anterior nodes, and some ventral and submandibular nodes you can do like this. Gentle gesture, gentle pressure, and downward only like this. And you can go to the back of the ear. So periauricular, the posterior auricular nodes will be drained, improved by doing this from like this, and go to the back of the neck, and the occipital nodes will be drained like this. If you do like this, occipital nodes like this, and preauricular nodes like this, and from here you can do like this, and here also like this, periauricular nodes, and posteriorly the posterior occipital and the posterior auricle, even the scapular, subscapular nodes also. I have to come to up to subscapular nodes like this. So this can be done, and you can start sometime from the you can empty the axillary node like this and like this. It will dramatically improve your brain lagging or the brain fog symptoms. And spinal column exercise also will improve. So I'll start with some physiotherapy from the neck. You can roll like this. You can roll your head the first step 5 to 10 times, and again you can roll like this 5 to 10 times. Then you can do a side to side rolling. So if I turn the right side, you keep the right hand like this and breathe in and breathe in, and while you turn in like that, exhale through the purse of your lip as far as you can, and hold like this and take a deep breath like this. Again deep breath. Five to 10 times to one side. Again you can do to the left side like this. Take deep breath. Always you have to take a breath from the nose and exhale from your purse lip, like this. 5 to 10 times you can do it, and you can shrug your or lift up your shoulders and turn like this. It will improve your thoracic lymphatic drainage, thereby the cervical drainage, like this. And even you can improve the cervical pump, like making like this and like this. It will dramatically improve those symptoms. So I think it will help to you all who have suffering from these kind of symptoms. Thank you very much for watching.